Hi everyone, welcome back to my YouTube channel. Today we are going to talk about nasal bone, and here at the side you can see the diagrammatic representation of nose area or nasal cavity area showing nasal bone and different other parts of nasal cavity. So for the reference, let's start a topic with introduction. Nasal bones are pair of small oblong bones that sit side by side in the midline of face. They form the bridge of nose as you can see here in diagram, providing a strong base for nasal cartilage and overlying soft tissue. Despite their size, they are critical for both aesthetics and functions. Talking about their location and orientation, they are found in upper middle area of face just below the frontal bone. They are positioned between the frontal processes of maxilla from the superior portion of the bony part of the nose. Anatomical features of nasal bone. First, we will talk about its external surface. That is convex in shape. It is covered by muscles of facial expression, including the posteriors. Second, we will talk about its internal surface. That is slightly concave. It features a groove or a small branch of nasociliary nerve. Further talking about anatomical feature, it has borders that include superior border that articulate with the frontal bone at the frontonasal suture, as you can see here in the diagram. Second is inferior border that attaches to nasal cartilage which continue the shape of the nose. Third is lateral border of nasal bone that joins the frontal process of maxilla, and the medial process that articulate with the opposite nasal bone forming the nasal bridge. Now let's talk about articulation of nasal bone. Each nasal bone articulates with the four bones. They include superiorly it articulates with the frontal bone, laterally it articulates with the maxilla, medially articulates with the nasal bone, and posteriorly articulates with the perpendicular plate of ethmoid bone, indirectly forming part of nasal septum. Now let's talk about functional significance of nasal bone. First is structural support, as it helps form the bridge of nose. Second is protective role, as it supports the upper part of the nasal cavity and sheathes the nasal mucosa. Third is its aesthetic role, as it influences the external contour of nose and overall facial symmetry. Fourth is attachment site, as it serves an anchor point for muscles and connective tissue of the nose. Now let's talk about clinical significance of nasal bone. First is nasal bone fracture. As among the most common facial fracture, due to the bone's prominence, it may cause nasal deviation, swelling, and breathing issues. Second is plastic surgery, as rhinoplasty procedures often involve reshaping or repositioning the nasal bone to alter nasal appearance or function. Third is congenital anomalies, as nasal bone abscess or deformity may be associated with certain genetic condition and can be evaluated during prenatal ultrasound imaging. Now let's talk about conclusion of this lecture video. Though small and often overlooked, the nasal bones are central to the both beauty and function of human face. From shaping your nose to supporting breathing and protecting underlying tissue, they are proof that little things can make a big impact. Thank you for watching. This was all about nasal bone. Hopefully you liked the video. Don't forget to like, share, subscribe and comment.